I don't know why, but this is one disease that always gives me the little tickles. I don't know why. I get so happy with this one, talking about this, lecturing on this one. Rabies. Okay, rabies has been around since biblical times before. Side note, the reason why I said the biblical times, it popped into my head. There are modern day anthropologists and medical researchers who think that some of the um, crazy prophets, the crazy people in the Old Testament, um, the hermits, the crazy hermits, and things like that, that people would cast, that throw out of the towns and stuff like that, may have actually been suffering from rabies. That some of the quote unquote demon possessed people were actually suffering from rabies. Now, rabies is a zoonotic disease. Okay, zoonotic means it is passed to humans by animals. Okay, there's not an insect, that comes and bites you. No, you have to be around and bitten by an animal for rabies to infect a human. Now, different animals, as we're going to talk about here, bats, skunks, foxes, dogs, cats, um, raccoons, depending upon where you are in the world, will be the predominant reservoir. It's out there in nature. Okay. Now, just because you happen to be in a part of the U.S. where it's raccoons that more often than not have rabies out there, they're not the only one. It could be in bats. It could be in foxes. It could be in pretty much anything that's mammal. This is everywhere. Okay, this is spread worldwide because mammals are everywhere. For us humans, and to a lesser extent, many of the mammals, we see that there is a long incubation period. Incubation period is anywhere from 1 to 2 months. And hence, that's the problem. Because sometimes you may not even know you got bitten by a bat or a raccoon or things like that. And it's not until a month or two later that you start showing symptoms of being sick. So a lot of times clinicians are only worried about what have you been doing the past week or so. And they don't always adjust the time frame. Have you been around any animals in the past week or so? Were you around animals in the past couple of months? Depending upon where you get bitten, that incubation could be longer, it could be shorter. If you're bitten, face, scalp, neck, highly vascularized, gets into the bloodstream, gets into the brain much quicker compared to bitten on the finger, things like that. After the incubation period, you hit the prodromal stage. You look at those symptoms listed there: fever, nausea, vomiting, headache, fatigue. You start to feel like basically the flu. I'm sick. I've got the flu. But it progresses. You start to get neurological issues, start to slip in and out of consciousness. The mental acuity starts to go away. They can't keep track of a sentence. They can't track along in a conversation. Up until about the last decade or so, rabies was always considered 100% fatal. Why 100% fatal? Because, you usually didn't go get or try to receive any type of clinical assistance until you had the onset of symptoms, and the onset of symptoms were going to be the expression of brain damage. There have been a handful of patients over the past decade and a half or so. Handful, literally. I believe it's like 6 now, 5 or 6, that have survived rabies. What they ended up doing is once the patient presented in the ER and they were able to identify based on symptoms, you have the onset of rabies. Okay, you've already missed the incubation period. You're now into rabies. They immediately put them in a chemically induced coma, and then they put them in a state of hypothermia. Hypothermia. They lowered the core body temperature. Okay, lowered the core body temperature, slow down the spread of the virus, and yeah, it did slow down their immune system, but by slowing down the spread of the virus and the immune system, they minimized the amount of damage. The immune system could catch up slowly, less damage, inflammation was lowered, things like that. The last time I think I read it was a 13-year-old girl here in the US survived. And a year or so later, her parents were happy because she relearned how to tie her own shoes. That's the level of mental damage, mental acuity that she now has. She will never be the normal 13, 12-year-old she was at the beginning of the onset. Okay? There were extreme mental damage there. Okay? So, you get bit, and during the bite, there is a saliva transfer. What happens in the animal, whether it's a raccoon, bat, whatever, they get exposed, however, a bite or during a fight or something. Animals are always fighting for domination within their social structures. Gets into the bloodstream, hits the central nervous system, then travels down the central nervous system to the salivary glands, infects at the salivary glands, as well as central nervous system. So that way, in the saliva, there's going to be thousands and millions of viruses. So they come, they bite the next would-be host, it's transferred there. Now, the normal, quote-unquote normal, hydrophobia, the heightened state of fight or flight that you see, the, I cannot think of the clinical term, the psychological term, the heightened paranoia that you'll see in human patients. These are all due to central nervous system infection and the alteration of what we would consider normal brain chemistry. Okay, so the accumulation of damage in the brain leading to altered brain chemistry, damage in the neural pathways, loss of neural pathways. This is how it presents: hydrophobic, manic, heightened, fight or flight, paranoia. They're also very aggressive. The aggressive part is also beneficial to the virus because if they're aggressive, they're biting, they're spreading it to the next person. Now, there are different stages through rabies. Okay, you get bitten, and then there's that 1 or 2 month incubation period. And then you see a subacute onset of symptoms then. Okay. What we want to do is catch patients in the early stages because there's still a chance for survival. Okay, it's in the later when they're presenting with symptoms that are significant of brain damage, encephalopathy, that the chances are minimal at best of survival. As I said, out there in the wild, canines, skunks, raccoons, badgers, cats, bats, it's going to be different depending upon where you're at in the world, in this country. For us humans, it's going to be exposure. The young girl that I talked about before, I forget honestly what age she was. She was mid-teenage years. Family, a bat got in their house and she helped her parents get the bat out. At no point in time did she know that she had been bitten on her hand as she was helping with a towel trying to catch or corral the bat out. Okay, For a lot of patients, that's the problem. They don't know they're bitten. Yeah, if you get bitten by, a larger mammal, a raccoon, a dog, yeah, you're gonna notice. But if it's something small like a bat, a lot of times you're not gonna notice that you've been bitten. You might think you just got scratched by something, by your own nail or whatnot. Okay, we're not talking a big bloody bite. Worldwide, 30 to 50,000 cases a year. Very few here in the States. Um, we're doing what we can to control rabies in the wild population, and all of our domesticated animals must receive rabies shots. So we're minimizing our exposure. Diagnosis, basically, it's going to be look at patient history, how they're presenting, PCR of the saliva you're testing for. Remember, PCR tests for the presence of specific DNA sequences, and they're testing for specific rabies virus DNA sequence. Is it there? They're going to test for antibodies. Do you have antibodies to the virus? Should you have antibodies? Now, people that are at a high risk, because they're a vet or they're somebody who's out and dealing with wildlife, one of the, park rangers or wildlife, monitors, things like that. We have really good vaccines for rabies. They will get the rabies vaccine. Pasteur actually started the looking into rabies vaccines, and now we have really good ones. So they will be vaccinated just like your dog and your cats are. They'll get boosters and things like that. Out in the wild, what they're doing now is they're trying to vaccinate large areas by dropping food pellets that have rabies vaccine embedded in them. So that way the raccoons, the skunks, wild dogs, cats eat the food pellets. We can bring down the numbers there. Now, for us normal people who are not park service, not a vet, veterinarian, for us, what's going to happen treatment-wise? Well, if you think you were bitten by a wild animal that you came into contact with, or hey, I think it may be it's just a scratch, but I'm not quite sure. It may have been a bite. Immediately go to the ER. You let them know you came into contact with the wild animal. Here's what's happened, and what they're going to do is they're going to start giving you the rabies vaccine. Because think about it. About a 2-month incubation period for the onset of rabies. But the vaccine kicks in. You'll be able to mount a really good antibody, antiviral, or B cell, T cell response to rabies within 2 weeks. Okay? So a series of injections. I'm not sure if they still do the abdominal injections. They used to do injection into the abdominal muscles, so that way it'll be retained in the abdominal muscles, and the vaccine components will be slowly released into the bloodstream, as opposed to directly IV, which gets into the bloodstream and may be cleared out quickly. So do it into the muscle, used to be the way they do it, and it would be a series of injections over, I believe it was a 6-day period. 2 weeks later, boom, you have an immunity to rabies well before the incubation period is over, so that your body will be able to fight off any rabies infection. That's under, perfect conditions. What they also have nowadays is isolated antibodies. You'll see there in that bullet, human rabies immunoglobulin, HRIG. So if you think I've been exposed, Not only will they start doing the injections, the vaccines, but they'll also give you antibodies isolated from other people who've had the vaccine and have mounted a high, really high antibody response. So it's a two-pronged attack. Prime your immune system, get your immune system up and running, and then the antibodies they're injecting you with will coat any viruses that are free floating around in the bloodstream. Slow down. If it's coated by antibodies, what they call opsonized, can't bind to a receptor, can't get into any of your cells, will get cleared out later. So that's under perfect terms. So if you or anybody you know ever gets exposed, I think I got scratched, I'm not sure if it was a claw or a fang or a tooth, straight to the ER, go ahead and just get them treated this way. Yes, they're going to get lots of injections, but, worst case is death. Best case, if they don't get the treatment, you get to help them relearn how to tie their shoes and what their names are and how to relearn their colors. So get the shots.